Hello and welcome to the Workforce Wisdom Podcast. I'm your host, Christy Bray, Chief Strategy Officer at PracticeLink. In this podcast, we will focus on the latest trends in healthcare recruitment while showcasing innovative strategies, success stories, and fresh perspectives affecting the healthcare workforce. These episodes will lead to in-depth, thoughtful discussions with recognized industry-leading healthcare professionals, exploring the challenges of healthcare recruitment and beyond. Whether you're an experienced recruitment professional or just starting out, this podcast aims to help you discover how experts are reshaping the industry, leveraging technology, and fostering inclusive hiring practices. Today's episode, Industry Insights, Empowering Physicians with Financial Wisdom, a conversation with Jim Hemphill. Today's guest, James S. Hemphill, is a founder and partner of TGS Financial Advisors and Triage MD. Jim finds purpose in supporting his clients' hard work and good financial habits, and in helping them achieve the positive outcomes they deserve. He takes a data-driven approach, focusing on tangible goals and robust progress management. Jim specializes in retirement transition and wealth transfer strategies. Additionally, Jim spearheads Triage MD, which offers financial advice programs and educational platforms for physicians at all career stages. He develops workshops that complement his books, Pay Yourself First, a financial guide for doctors entering practice, and Changing Outcomes, a financial recovery strategy for peak career physicians. Jim has been a certified financial planner professional since 1982. He received his Certified Private Wealth Analyst designation from the University of Chicago's Booth School of Business and his Certified Investment Management Analyst designation from the Wharton School of Business. Jim resides in Westchester, Pennsylvania. He is married to Amy, who received her master's in public health from the Bloomberg School at Johns Hopkins University. She does big data for the Nemours Pediatric Hospital System, and they have 3 children, Anna, Catherine, and Alex. Welcome, Jim.
Christy, thank you very much. It is great to meet you. And I'll start, we are a regulated business, perhaps not as much as medicine. So I have to state that we're a fee-only investment advisory practice, and nothing that we're going to talk about today is investment advice. This is intended solely to be educational in nature and does not constitute investment advice in any way for any individual. And so having gotten the regulatory stuff out of the way, it's, again, great to meet you and happy to be here.
Yeah, thank you so much. That is an impressive career and resume with not only your commitment to education and training so that you can help others. We'll just dive right in. So tell me, when did you start working with physicians?
So I've been doing this for a while. I started in the business in 1978 and started working with my first doctor client in 1979. She walked into our office with a check for $80,000. And opened an account and bought, as I recall, IBM and GE stock, which she held for 4 decades. So pretty long journey working with doctors, fascinating people. In many ways, many of the most fascinating interactions aren't even about medicine. They're just about hobbies and interests and so on.
With your Triage MD platform, you focus on providing financial education to physicians. So what unique financial challenges do you feel like they face that other professions might not?
It's a really good question. So I'm going to break it down into 3 things. The first is temporal, the second is financial, and the third is psychological. So temporal, we talk a lot in our education programs about the time value of money. And the first challenge physicians have financially is they just start later than everybody else. When I talk to young physicians, I'll ask the question, do any of you here have a college friend who's a computer science graduate or a mathematician or an engineer who started making real money when they were 22 years old, and they're now in their late 20s or early 30s, and they've already saved $500,000? And so the engineer has $500,000 in the 401k, and the physician has, and this gets to the second challenge, the physician has somewhere between $190,000 to $225,000 of debt. The average is over $190,000 if they went to a public sector school like a Penn State Hershey, and if they went to University of Pennsylvania or even more Drexel University, they have $225,000 of student debt. The highest number that I've ever seen was over $700,000 of student loan debt for a physician couple, both of whom were specialists, both of whom were immigrants who had debt from all the way through undergrad plus medical school. And then the final challenge, which in some ways is kind of the most important and where we really try to provide effective input or insight, is psychological. And the psychological challenge is, okay, so now I'm 28 or 30, or one of our clients started at 36. He started with us at 36. He was the senior fellow in cardiothoracic surgery at a mainline hospital just outside of Philadelphia, and making a little over 100 with $400,000 of debt. So he wasn't going to get his first real paycheck until he was 36. So the psychological challenge is that a doctor starting out, even a family medicine physician who might be starting in her late 20s, has worked hard in high school to get into college, has worked hard in college to get into medical school, has worked hard in medical school just because everybody works hard in medical school, but then even harder in residency. And everybody else has been making good money, buying the house, taking the vacations, owning the car, and they haven't. They've worked harder than anybody else. And once they start earning money, oh my gosh, the psychology is, I am due, I'm overdue. Now is my time to enjoy the lifestyle that I've been working hard for all of these years. And the psychological problem is that they feel entitled for good reason. They have been deprived objectively. And the only time that a physician can do two things at once, can improve their lifestyle and can also increase their savings, is when they start. If you get the balance right out of the gate, then you have every reason in the world to believe you're going to be financially secure by normal retirement age, and you're not going to have to worry. And most of them do not get the balance right. Most of them start off, they say, I'm going to catch up with the lifestyle that I haven't had. I'm going to do that for these first 10 years, and then I'm going to start pounding on the savings. And just because of the time value of money, just realistically, it doesn't work.
You started with those early career physicians, and it makes a lot of sense where they need to align and maybe level set some of those expectations. I think that timestamp you put on, they start earning later. They are earning a lot in most cases, but it is later when you look at what traditionally folks coming out of undergrad straight to work or even a master's program. So what are some of the common financial mistakes you see those early career physicians making?
5 or 10 years ago, we would see folks who didn't really understand public service loan forgiveness, just what a huge opportunity that is for doctors in particular, because over 60% of doctors and closing in on 80% of primary care doctors work in nonprofit environments. So public service loan forgiveness is very realistic for them. And 10 years ago, when you had the first people who were eligible, nobody had the paperwork right, nobody had the right kind of loans. And that has cleared up to a significant degree. So I would say that one of the mistakes they make is not accumulating public service loan forgiveness months during residency and fellowship, when the cost of acquiring a month is so much lower. One of the things we talk about is that the currency of loan forgiveness is time, not money. It's months. It's 120 months. So if you can buy a month using income-driven repayment strategies for $250 your first year of residency, wow, that's a lot better than buying that same month for $3,000 after you start practice. So that's one thing. The other thing just gets back to this issue that we just talked about of finding the right balance between saving and spending out of the gate. So what we like to see is for folks to set the right kind of target for how much they want to save, and then just make it automatic. So one of the related mistake here is to say, Well, yeah, so I'm going to put money away in my 403b or my 401k. And then at the end of every month, after I've done all of the consumption that I'm going to do, I'm going to be disciplined. I'm going to have money left over. And the money that is left over, I'm going to put into savings. And that's going to be how I'll build my wealth. And the reality is that our grandparents did that. Our grandparents got their paycheck and may have been paid in cash. And then they took their little fistful of dollars down to the savings and loan and they deposited it. None of us do that now. So one of the mistakes is not making savings automatic. If you make savings automatic, then you're going to be fine in terms of spending. If you expect to discipline yourself week by week, day by day, month by month, and save money after that, that really doesn't work for most people.
Right. I think it's interesting when you talk about how they allocate their pay. I always refer to their student loan debt as a mortgage on a beach house that they don't get to go to vacation in because the payments, if you are going towards the public service loan forgiveness, those income-driven payments become exponentially higher when you've taken your first job versus what you're making in residency.
Absolutely. When you look at loan forgiveness, there are interesting situations, for example, with two physician couples or where one partner might have higher loans and lower income. So in some cases, we actually have physician couples where they will file their taxes separately, married filing separately, just so that they can get the income-driven lower payments for the one spouse with potentially a lower income and a higher student loan balance. So there really is kind of a devil in the details aspect to that.
That makes a lot of sense. I know it's important that you provide that guidance to set them up right. And maybe that was your inspiration behind your book, but could you share what was the inspiration behind your book, Pay Yourself First?
It's a really great question, and it's kind of a long answer. So typically, the financial services industry, the fee-only part of the industry, which is where I am, has started working with doctors when they're in their 40s or 50s. So a doctor will have built up $1 million, will think, well, now I'm starting to get rich. Now I need a financial advisor. Let me start talking with a financial advisor. So we would get, for example, a cardiac surgeon coming in the door at age 55, with $1 million in a retirement plan, with a beautiful big house, with a beautiful big beach house, with 4 cars in the driveway, and come in and say, hey, I'm rich, I've got $1 million, and why don't you give me some financial counsel? So $1 million portfolio is a great engagement for a financial advisor. $1 million portfolio for a physician age 55 who makes $800,000 a year is a disaster. So we would get doctors who had underaccumulated for decades, and then our job was to help them to earn enormously high investment returns year after year so they could make up for decades of undersaving and have enough money to retire when they wanted. And that's tough, and that's not realistically something that we or any other financial advisor can do. So we started really thinking about, well, what's going wrong here? What can we do to make it better? And we hired a new director of physician outreach. She had worked for the American Heart Association. Her father and brother are both doctors. And we sent her out to find us more 55-year-old doctors with $2 million. And she came back pretty quickly and she said, everybody's looking for 55-year-old doctors with $2 million. And those folks have no trouble finding financial advisors. But here is what the director of a residency program said to me. What we need is people to help our young physicians, our young doctors who are in residency and fellowship, who are about to start making real money and who don't have a clue. I know I'm not supposed to say don't have a clue, but that's what she said. And so Catherine Kaiser, who's our director of physician outreach, said, we really need to help these people. What solution do we have for them? And I said, well, we give investment advice. I mean, once they have investments, we can talk to them. And to her credit, she said, that's really not a good enough answer. We need a better answer for these people. So we started working on developing an education program, an advice model, and it's really been a very fun and interesting journey because it really is not a set of investment questions. It is young people who are very smart, very accomplished, with very good incomes, and they have a balance sheet problem. They have a debt problem. And so we've had to develop an entirely new way of looking at finances and looking at financial advice to help this group of absolutely interesting and kind and fascinating people to get themselves on track when they're young. So by the time they're 45 and 50 and 55, they are confidently on track toward a financially secure situation. There's a phenomenon that we've observed for years. There's kind of a gallows humor among doctors, especially the most highly compensated doctors, where they say to each other, yeah, are you going to be able to retire? Well, no, I'm not going to be able to retire. Well, what are you going to do? Well, I'm going to work until I fall over. And there's a huge amount of financial stress associated with that. Just not having confidence about your own long-term finances, especially if you're making what society considers to be a very large amount of money, that stress is considerable.
And I think what you see in the lifestyle components, and these are, some high net worth individuals from an earning capacity, but it doesn't always even out in terms of the expenses, their debt, and then thinking forward to the retirement. I know we saw it in the health system I worked at several years ago when the stock market crashed. I think that was 2008, maybe it was before that, where we did have guys that lost a lot of their retirement savings, and they were within a 5-year window to retire, and they said, not now, not at the lifestyle that they were accustomed to living, probably the same housing crisis, all those things in the economy.
That all hit at once, that we're all reinforcing. So in the tech crash, we had a crash in the stock market. But then we had appreciation in real estate. So people at least kind of felt like, well, I've got something going for me. And then in the financial crisis, we had a crash in the U.S. housing market that spread all over the world, followed by a crash in financial assets. And so folks were underwater on their mortgages at the same time that they had lost 40% of their portfolios. And that was really devastating for folks.
And I think now we're seeing post-COVID, the physicians that were close to retiring, they did hang on, but definitely 2022, 23, as we continue down and they age, you just see a vast chunk of our physicians retiring and leaving the workforce, just widening that shortage gap that we have.
That's so true. It's worst in medicine, I would say, because just the mechanisms and psychology of practice were so difficult during COVID and afterwards. But it's a general problem in the economy that we're losing the baby boom generation. There's this enormous base of institutional knowledge. And then after the baby boomers came the baby bust, and all of a sudden, all kinds of professions are being sort of hollowed out in terms of institutional knowledge. In my own business, there's a whole generation of advisors who started when I started, and they're now in their 60s and 70s, and some of them even beyond. And coming after us is this sort of missing generation of advisors. And it really is a problem. It's a problem for medicine and for my profession as well.
Sure. And I think there is a limitation to tech to be able to fill the gaps, as you said, with that institutional knowledge. So let's talk a little bit about some of those transition strategies. As we know, physicians are high net worth individuals, and so their transition to retirement is complex, just like we talked about. So what are some critical steps that they can start doing or think about as they're approaching retirement to manage their wealth effectively?
I'll go back to something that we were talking about before, which was COVID. During COVID, we had a flurry of referrals coming in from existing physician clients of friends who were desperate to retire. And something that was pretty interesting is, so we would do the planning, and some folks had enough assets, and we could say, here's your mechanism by which you can retire. Some of them didn't have enough assets, so we were, in those cases, working creatively. Do you have unproductive assets that we can repurpose? Do you have a condo on a golf course in South Carolina where you go twice a year and, oh my gosh, let's sell that. And if you still want to go play golf in South Carolina, rent a hotel room twice a year. Something that was super interesting was that we had people coming in with enormous compounded financial stress, feeling like they couldn't retire, and also workplace stress, saying, I never wanted to practice medicine over the computer. That's not how I was trained. So tell me whether I can retire. And what was interesting is in some cases, we would run all the numbers, we would talk about strategies, we would look at different resources and say, okay, here's the fact pattern. You can retire in 18 months. And then the doctors would come back and say, oh, now that I know I can retire in 18 months, I want to keep practicing. So the financial stress compounding all of the work responsibilities and stresses of medicine, the combination can be debilitating. So something that's very interesting about retirement transition is knowing you can do it can reduce the psychological stress enough that all of a sudden I don't need to retire tomorrow to manage my stress. And that, I think, is a very interesting outcome that we observed during that period. When we talk about stages of career, when we start talking to a 28-year-old or a 32-year-old early career physician, and if we say, let's talk about retirement, they have no concern about that at all, right? They're not thinking about retirement. They're thinking about how do I get started. So what we say is, in your early years, we want you to have clarity about your finances. We want you to make the right kinds of decisions so things are just on automatic pilot and you're progressing the way you want to. In the middle of your career, we want you to have confidence. We want you to understand your finances and to have rational belief that you are on track toward a successful life and successful retirement. And then toward the end of your career, we want you to have options. We want you to be able to continue to practice if you want, to stop taking call if you want, to be able to choose to go somewhere else and do something different. We've had physicians who have substantially retired. I think about my uncle, who's now fully retired physician in rural Washington State. First, he retired from delivering babies. Then he retired from basically general practice, from family practice. And then for 5 years, he was a licensed private pilot. And he continued to do the medical examinations required of everybody who has a pilot's license. Because he would have all of these pilots, people who had potato farms in Idaho, and they would come in and he would do all the testing and they would talk about flying planes. So at the end of the career, just having the option to be able to continue to practice and to be able to practice the way that you want, that is so valuable to people.
And we do see those transitions a lot within healthcare organizations. It's kind of that progressive slowdown from taking call and potentially, in your example, delivering babies, that's a taking call piece. And then slowing down, I think some innovative organizations have really started to leverage that talent, though, as those physicians are stepping back, still use them during that time as mentors to the new graduates that they've hired and create that mentorship type model. Because I do think while they may be tired or burnt out from practicing medicine, I think they still have that drive to help and educate others, and it gives them a purpose. So seeing those programs be really successful, maybe they'll start earning a little paycheck even at that point. And it sounds like the data-driven approach is essential when you're working with folks to set these goals and measuring their progress.
It really, really is true. I recall some years back, I was meeting with actually the physician head of the American Heart Association and had a very nice dinner in Chicago. And he was saying, well, doctors really, really need data. We need information. If you could just say, here is the perfect proof of the perfect investment, that would be very helpful to us. Well, we can't really do that. But we have developed a concept that I think is very helpful, especially for early career physicians, which is the concept of functional net worth. And functional net worth, the definition that we use, is it is all of your productive assets that can put money in your pocket in retirement minus all of your debts. It doesn't include your sailboat. It doesn't include your condo on the golf course in South Carolina. It doesn't include your home. So by measuring functional net worth, we really get a much clearer picture of whether folks throughout their careers are on track toward, first of all, clarity, second, financial confidence, and then finally toward retirement, financial security, financial independence. So that's a concept that we've pioneered, and it's measurable. It lends itself very well to just having a single visual measure that you can look at and see if this number is going up at the right rate, you're going to be fine. You mentioned before the financial crisis. During the financial crisis, people just lost confidence because they said, oh my gosh, how can I be financially okay if my net worth is down by 20%? And what we would say is, look, we're measuring your savings every year. With the stock market down by 60%, every dollar you're saving is that much more valuable. As long as you keep saving to target, a bear market is actually a benefit. You get to buy more financial assets at a lower price. So measuring the right things, measuring functional net worth as a balance sheet item, and measuring net savings as an income statement item, those are two crucial measures. If they are on track, you're going to be fine, even in good and bad markets.
That's great advice. And I think you're looking at a more broad picture than maybe their monthly bank statements or something. It's a very broad picture of their assets and their wealth.
Do you want to know when to do what in your job search? First Practice, PracticeLink's resident and fellow career guide, teaches you 10 easy-to-follow steps every prospective physician needs to find their dream practice. And best of all, it's completely free at firstpractice.com. Becoming a physician is hard. Finding a job doesn't have to be. Thank you for listening. Now we'll return to the podcast.
All right, for these next couple of questions, get your crystal ball out. We're going to talk about some trends and some things you might be seeing, but as someone who's deeply involved in investment strategy and financial planning, what emerging trends do you see shaping the future of wealth management? There could be some pieces with the new administration coming in that might change some of this. I know the student loan process and the student loan, even that Department of Education, has a lot of people wondering what's going to happen to public service loan forgiveness or those things. But tell us if there are some other emerging trends you might see and what we might expect of this new administration.
So I'll start just by talking about a long-term trend in my own profession. So when I started off as a financial advisor, I was a stockbroker. It was in the late 70s, and all compensation for people in the financial business was in the form of commissions. And what has changed over more than 40 years is a steady progression toward higher levels of professional training, expertise, and certification, and a powerful trend away from sales-based compensation to fee-only practice. We see a similar kind of trend in medicine. My wife does big data for a hospital system. 70% of their income is value-based care. So they are getting paid for results. They're getting paid on a per-patient basis. They're not getting paid for procedures anymore. So the same kind of thing is happening with the financial advice profession. We have been fee only for 15 years. So no commissions, all of our advice is objective. We're held to a fiduciary standard, which is analogous to the Hippocratic Oath, right? You put your patient's interests first and do no harm. So I think the quality of advice is better. In terms of the macroeconomic environment, we are in a peculiar position where financial assets are very, very expensive. And psychologically, we think about that wrong. So one of the questions I'll ask groups of young physicians is, do you guys want the stock market to go up or to go down? And everybody says, oh, we want the stock market to go up. We want to get rich. And it's actually the wrong answer, because the stock market, the price of the market is always variable. If you are a saver, you're a net buyer of financial assets. And anybody who buys anything is advantaged by having lower prices. So in terms of what could we do to help young physicians to have better financial results over the course of their lives, well, a nice big bear market that drove stock prices down by 50% would really benefit them. Wouldn't help me and my business, but thinking clearly about that, thinking clearly about the fact that we're going to have fluctuations of prices for our entire lives, and anyone who is a saver, in fact, benefits from lower prices. And then you can generalize from that principle to say, well, let's look all over the economy, and actually let's look all around the world economy, and let's find those places where we can find assets that are out of favor, that are less expensive, never mind whether they've gone up or down for the last 2 weeks or 2 months or 6 months or whatever. Where can we find assets that are fairly priced, that produce durable cash flows, where we can make good returns? And that's harder today than it was at the bottom of the financial crisis. You could buy all kinds of stuff with prospective returns of 12 and 15 and 20%. Now it's 15 years later. We've earned those high returns. Things are more expensive. We have to be more careful. In terms of this new administration, that's a really good and difficult question. It's kind of a fraught question, right? Because the politics of it enters in so strongly. I'll confess I'm not happy with how things went, not happy with the result that we've seen. The reality is that I have a fiduciary obligation to give good financial advice, even if the political environment isn't what I want. Overall, I think that the big thing is you want to be careful, and you want to avoid going too far with the idea that I'm going to change my strategy because the political environment has changed. At the risk of offending some viewer somewhere, I'll say that there's a stock out there that the ticker symbol is DJT. It's Trump Media Group. It's economically valueless. It doesn't make any money. It takes $10 million a month to keep Truth Social running, and it's doubled in price since the election. There's a phenomenon for the last couple of years called meme stocks, where someone will have an idea about GameStop or AMC Cinemas, and people will pump them up and they'll go up, and people buy them because there's a lot of buzz and a lot of news. Really important in an economically uncertain environment to make sure that there is a really, really clear connection between anything you own and fundamental underlying economics that you understand. I know it's not really an investment call, but I'll just mention one thing. So something that we've been buying is pipeline companies, because now they've gone up recently, but they're economically cheap. We're going to continue to use oil and gas. And in the last administration, they were very, very much out of favor, which benefited our clients because we could buy them cheaper. I think that a lot of the regulatory environment around oil and gas is going to change, and that will eliminate an area of uncertainty. The question you asked about student loans, it is such a great question, because what we've seen over the last couple of years is we have seen the Biden administration wanting very much to provide student loan relief without having a solid legislative basis on which to do so. And we all want the government to do things that benefit us, whether or not the government has the power to do so. I think that a lot of us will be very happy if it turns out that the government doesn't have as much arbitrary power as it wants to have in these coming years, right? We want our government to be restrained by the law. In terms of student loans, part of what we're seeing is a political fracture between the highly educated and less educated. And so student loans, I think, are possibly going to be on the radar. And all of that said, one of the rules of financial planning is we deal with the regulatory structure and the tax laws and the rules that we have now. I can't tell you how many times over 40 years I've had a CPA come back from a conference and say, oh, we know that the tax law is going to change in this way, and it doesn't. Or an estate attorney come back and say, oh, we know that the estate laws are going to change in this way. Right now, we have documented advantages for student loan forgiveness, and we want to make sure that we take every step that we need to take to pay those loans on time and to document those payments. The political environment has changed. I'm an old guy. The political environment changes a lot. And I think the pendulum always shifts back. So let's look for our advantages that we can document and take care of each other just to talk about something that's not financial.
And I think the potential to grandfather those folks in who were already down the path of the 120-month public service loan forgiveness program, they were really counting on that. I think folks can rest easy that that would be a piece of it. And I think equally that the program, when it was launched, it hasn't achieved what it was set out to do in terms of the number of applicants that get rejected. It isn't a high approval rating.
I'll push back against that a little bit. When I started doing presentations on student loans about 10 years ago, or I'm going to say 8 years ago, 6 years ago, 2018. So 2018 was the 10th anniversary of the creation of the student loan program through legislation during the tail end of the Bush years. And theoretically, there were going to be 500,000 or 1 million people who would qualify for student loan forgiveness. And the actual number in the first year was 82. Just nobody knew what the rules were. Things were so confusing. There were people who had paid on their loans for 10 years, and at the end of the 10 years found out that they had the wrong kinds of loans. Last year, there were more than 500,000 people who got student loan forgiveness. So people are really figuring this out. There's some excellent student loan consultants out there. You and I discussed one of them, Joy Navarre of Navigate Student Loan Consulting. We work with her with our clients all the time. So we're seeing a lot more people achieve loan forgiveness. Loan forgiveness is statutory. It's in the law. You're not going to be able to get rid of it. You can change the regulations around the margins, but you're not going to be able to get rid of student loan forgiveness without changing the law. I don't think that's going to be a priority. And one of the rules of American politics is you don't want to get a very specific, narrow constituency really, really angry with you. So saying to millions of young American physicians, we don't have enough physicians as it is. We've already angered physicians with a bunch of policy stuff. But on top of that, let's also take away your eligibility for loan forgiveness. That's not a group, I think, that anybody wants to make angry or get on the wrong side of. At least that's certainly what I hope and wish.
No, I agree with you there. As we move forward in this tech age, I'm curious to see a lot of the financial planning and the strategies you've talked about. Some of them, it takes a while for that fruit to bear. So has there been, or do you see a place where you are able to leverage technology or AI, maybe do some data analytics, maybe in a quicker way, create those progressive models that look out, and then how accurate are they over time?
So AI has very limited utility for investment policy for retail investors. So if you look at one of the huge trends in investing has been a move from active investing toward broad-based passive index investing, which is more tax efficient, it's lower cost. There is some meaningful application of AI to short-term high-risk strategies like hedge funds. One of the things that we observe is there's a lot of use of AI by retail investors trying to run their own portfolios who don't have formal training and don't know how to fact check. So you can get very increasingly well-written, factually incorrect information from AI kind of at the touch of a button. All of us now have a tab on our browsers that is access to ChatGPT or one of the other variations. And all of us, sometimes a couple times a day, will have a question, we'll start with a question, and we'll go to ChatGPT and we'll download text, and then we have to make sure that it's accurate and that it's usable. There are certain aspects of medicine, for example, where it appears that well-designed AI systems that are cross-checked by expert human physicians will be another tool that physicians can use to improve health outcomes. My wife, I mentioned before, she does big data for a hospital system, and they're using AI every day to try to figure out for large populations, especially populations of underserved patients, what are the drivers of better outcomes. So we use AI for that purpose, but we use it very, very carefully.
And I think the key thing you mentioned there is it's great to start or initiate some ideas and asking it a question, but you do have to take the time to really carefully analyze what's there. And to your point that, it easily can spit out inaccurate information that looks like fact, but you do have to do your own legwork in those cases.
It's interesting because when I started interacting more with the medical system, you get to be in your 30s and 40s and you see doctors more often. And something that I noticed is my wonderful primary care physician internist who retired a couple of years ago, we would talk about this and that, and then he would excuse himself. And I always thought, well, he's going to see another patient. And no, what he was doing is he was going to consult a reference work because nobody can remember everything. And he was going to get crucial information that would help him he was a brilliant diagnostician, but he would also consult with sources of reliable information to help him to make good healthcare decisions. AI can do those things, can help us. It has to be in the constraint of actual professional expertise.
I think what you said was key about the well-written AI, much different than just throwing questions up into the wind. I do remember the days of gigantic PDRs, physician desk references. There were massive books that the physicians would keep on their desk, and that was probably what he was referencing then. So let's move into some more advice for the audience, primarily physician audience, but recruiters, there are tools that you can help or conversations you can start with candidates as they're recruiting. And it does help from a retention standpoint. It builds some relationship when you're able to offer some of these tools. But for those new to financial planning, particularly in, as you mentioned earlier, these high-stressed, high-burnout professions, what advice would you offer them for developing some strong financial habits?
A big thing is just making things automatic. We talked about this a little bit before. Don't rely on your own exercise of virtue by just not getting dessert when you go out to the fancy restaurant. Make everything automatic. So all employers these days give you the ability to direct money to different accounts. You can send part of your paycheck to your joint account with your spouse that you pay your household bills from. You can send part of your paycheck to your mortgage company so your mortgage is paid automatically. One of the things that we set up with young doctors is we have one account that is their after-tax savings account. That's funded automatically from every paycheck. So they don't have to worry about whether or not to buy 2 appetizers because their savings has been taken care of. It's automatic, and then we will help them to direct that savings dollar to their best opportunity to advantage themselves financially. What that best opportunity is, even for one individual or one couple, that changes over time. So at one point, it might be prepaying a mortgage. But at another time, for example, in the time of very low rate mortgages, we told everyone, get a 30-year mortgage. You've got other things that are much better economic opportunities than prepaying a 2.5% mortgage. So in that environment, we would tell people to save and to direct money towards certain kinds of investment opportunities. That said, just in general, one unerring principle is we do want to always start by directing savings toward fully qualifying our pre-tax saving opportunities through our employer. In every case where we run the numbers, the best single thing you can do with your money, besides buying those public service loan forgiveness months as cheaply as possible, but the next most important thing is always maximize your savings through your 403b or 401k.
So, Jim, I know we were talking about some advice for the audience and really those folks looking to set themselves up for future success and retirement. What are some essential elements of a solid financial recovery strategy, as you discussed in your book, Changing Outcomes?
When we work with physicians, and this is pretty common, who have underaccumulated and who are looking to make kind of a mid-course correction. So some of the moving parts are, if you have unproductive assets, make them productive. If you have properties that you don't use often, which is not that uncommon, sell the properties, take the money, apply it to something else. A huge piece of leverage that many, many Americans have, professionals in different professions have as they approach retirement, is they have way too much house. So downsizing a house is a one-time strategy that it's an enormous, powerful lever that most of our physician clients have available and can press. It's not just that you can, for example, sell a mansion in Haverford, Pennsylvania, and then buy a condo in Conshohocken near all of the nice restaurants and put $500,000 or $1 million in your pocket. It's also all of the associated costs with upkeep that are almost certainly way larger than they think you are. And then the third order advantage is that if your neighbor isn't driving a new Mercedes every 3 years, you don't have that tug of social comparison to also suggest that you need that new Mercedes every 3 years. So probably the single most powerful lever people have to turn around their finances and improve their finances as they approach retirement is simply getting into less house that is less costly, and that can be a game changer just by itself.
Sure, that makes a lot of sense. With your work with Triage MD, how are you empowering those physicians really to take control of their financial future? Maybe a couple of success stories or positive outcomes that you've seen.
So just one thing that we've done a lot recently is if you have paid off your mortgage and if you are subject, as we all are, to the SALT limitation, and so you can't deduct your state and local taxes, most of us now, even higher income folks, we don't itemize anymore. So something we observe is almost every physician has substantial charitable expectations and obligations, right? They have commitments that they've made to their alma mater scholarship program. They have commitments to the hospital's building program. And let's say, for example, that your total charitable commitments are $20,000 a year. You never get above your standard deduction that's now part of the tax code. So figure out what you're going to contribute over the next 10 years and put it all into a donor-advised fund, which is a kind of charitable vehicle. Get a huge tax deduction in 1 year, and then out of the donor-advised fund, just dribble out the money over the next 10 years. And what you do then is you take money that was substantially non-tax deductible and you capture a tax deduction. You're not giving any more to charity, you're just giving it all at once in a more tax-efficient way. In broader terms, what I would say to all physicians is we know a lot in finance. Those of us who are credentialed and experienced and who are compensated by fees, we know a lot about what constitutes financial best practices. Really, just as medicine has advanced so dramatically in the last 20 or 30 years, the practice of financial advice has also advanced dramatically. We know what best practices are. Following best practices leads to greater financial confidence. Just as, despite all of the advances in medicine, there is so much bad advice out there about medical practice. We're about to put an anti-vaccine crazy guy in charge of the FDA we're talking about. So there's bad information out there as well. So nobody should be taking medical advice from Robert Kennedy Jr., and nobody should be taking financial advice from some guy running a pump and dump trading scheme on the internet. Work with people who are credentialed, who are experienced, follow best practice, make sure you measure your results so you know what progress is. And I truly believe that every physician starting out has the opportunity to create a financially secure and rich future for themselves and to live a life free of financial worry and stress. And if there's one thing I can say to take away from this conversation, it would be that. And in cases where we can help with that, we love doing that.
No, I think that's great advice. I think lastly, as we look to wrap up here, for those recruiters out there, maybe some staffing professionals or HR benefit managers, a lot of times are listening to this type of podcast, but what should they understand about the financial needs of physicians to help create more comprehensive support programs?
I think that something we're starting to see is we're starting to see residency programs and hospitals start paying attention to financial education. Something that is clearly true is financial stress is an enormous component of overall physician stress. And unmanaged stress is a practitioner availability challenge. It's not most hospital systems or most institutions, but I think the leading institutions are starting to figure out they need to help doctors to put themselves in a financially strong position, because financial stress is a contributor to absenteeism, it's a contributor to stress and fatigue and poor decision-making, even in a clinical context. So providing more resources for physician financial education, I believe, is one of the best investments that medical systems can make.
I agree with you there. I think along with TGS Financial Advisors and our other strategic partner, Navigate Student Loan Counseling, really providing that bench of service to our physician and clinician candidates that engage with PracticeLink. On behalf of myself and PracticeLink, we want to thank Jim Hemphill for appearing on the Workforce Wisdom podcast. For our listeners, please feel free to reach out with any thoughts, insights, or questions about anything we covered today, or if you wish to receive more information about TGS Financial Advisors, please visit our website, specifically in the Resource Center section, or email plmedia@practicelink.com. My name is Christy Bray, and I thank you for listening to Workforce Wisdom. Thanks again to Jim for joining me on this podcast today.